we're gonna pull this. Awesome. And on elbow. Good. Okay, so checking the camera. Yep, that works. Gonna get you to take a big breath in for me. And all the way out. Good, good, good. Got a bunch of them just rolling you over. Yeah. There were some more still hiding. Okay, big breath in. And all the way out. Good. That was a big one. Good job relaxing. Hi, Mariam.
Hi.
Thanks for coming in today.
No problem.
Mariam is a now regular patient who I began treating. How many months ago was that about? If you had maybe like 3, 4?
Yeah, 3, 4 months
It's
ago.
been a while, but she was initially brought in by her mother for complaints coming up in her upper back, getting headaches, kind of generic all over the place. And since then, I think she's seen a lot of improvement, and I hope that she would agree with me on that. So much so that she's volunteered to be in this video. So thank you to Mariam there. So I will actually let her talk about herself and the condition that we're dealing with together. So Mariam, why don't you just go ahead then?
Yeah. So initially I came in because, as he said, I was getting a lot of back pain and neck pain. I think it had to do a lot with like studying as well, being in high school.
Mariam has just graduated high school and is going away to her first year of undergrad studies, so congratulations to her as well.
Thank you.
You can continue.
Yeah, and I was also for my job, because like the way I was like constantly having like lifting heavy stuff.
And what was it that you were doing?
I was working as a deli clerk.
Right. You were working at a deli clerk. Deli clerk?
I was working as a deli clerk.
Got
so
it.
I was working
Okay.
at the deli.
I heard deli clinic because I just that's not a thing. Okay, good.
Yeah, so I don't know, so it kind of developed from there. I'd like finish every shift and have like a lot of pain. And yeah, I would develop like a lot of headaches, and so I think it was you that told me to get the X-ray done. Yeah. And it turns out that I had mild scoliosis as well. Yeah. So ever since I've been coming in for sessions, and yeah, I've been doing a lot better.
Yeah, so Mariam initially came in with very, very common complaints of a student, you know, like I'm getting headaches as a result of my studying, I'm bent over, I'm sitting a lot, but there was something a little bit different that I noticed on initial examination, and that was that there was a very, very mild curvature to her spine, and obviously I'm not talking about the normal curvature. Sent her for an X-ray, and lo and behold, she's got a very low-grade scoliosis. But knowing that really helped to kind of steer the pathway of what we should do treatment-wise, and we'll get into that more as the video progresses, alongside just what a normal treatment session looks with her now. So yeah, for now we will do a reassessment. We'll get into the physical exam. Do you have any questions before we get started with that today, Mariam? No?
No.
Awesome. Then we'll get into it. Originally, Mariam came in with, we're getting the neck pain, the upper back pain, as well as the headache. So the first thing we did was a neck screen. So as per normal, you guys are probably pretty familiar with it. They do it with almost every patient. Mariam, I'm going to get you to bring your chin down to your chest for me. Good. And I'm going to do a little bit of overpressure. Are you getting any stiffness kind of down the back here? No? Okay, good. We'll come back up. We'll look up towards the ceiling. Any discomfort in the back here? No? Awesome. With a little bit of overpressure. Anything going on there? No? Good. Okay. Rotate your head to the right, please. We got about 80 degrees. Very good. And rotate your head to the left, please. And another 80 degrees, so she's solid on rotation. Now, back initially when I saw her, I don't even know if she remembers this, but the forward flexion as well as the extension were very aggravating to her because everything was quite seized up. Now, one thing to notice with scoliosis, depending on whichever direction the curve is, no matter how mild the degree, is that you'll get a little bit of asymmetry in the shoulder heights. That's actually common in most normal people too, depending on their hand dominance. You'd find whichever hand they're most dominant on, they have more hypertrophic muscles, and that side's going to be lower down typically. Now, in this case, Mariam has a little bit of a higher right shoulder than left, I believe that it is. Let me come in and confirm that. Yeah, it kind of looks like that from my angle. But that's in line with the X-ray that I will either show you here or I've shown you earlier, that her right side is hiked up a little bit higher just due to curvature of the spine. Now on that note, Mariam, I'm actually going to also get you to stand up for me. So one test that you can do if you're suspecting scoliosis in either your kid or a patient or something is known as Adam's test. No association. I didn't make this. It just happens to have the same name as me. And it's quite simple. So I'm going to ask Mariam here to bend forward and try to touch her toes for us. And what we're looking for when she does this is if there's any asymmetry back here. Now again, Mariam's got a very, very low curve, but we are seeing a little bit of hiking or rib humping. That's the term that's used to describe this on her. I believe that's the right side. Yes, Mariam, you can come back up. So that rib humping is considered a positive test and was really the thing that indicated sending her for an X-ray, which then helped to guide the entire formation of the plan of management. And again, now she's feeling better. So Adam's test, use it on your teens if you think they have scoliosis. So the body is a chain, okay? Anytime you're having an issue with one location, it's very good form to check both above and below that location to see if there's any kind of compensatory effects going on. So in Mariam's case, we have that mild curve up in the thoracic spine. So it's good form to check for the lumbar spine as well as the neck. Now I've already checked the neck range of motion, which completely checks out considering she has improved a lot, but it's also good to check the lower back too. So as per always, we're going to start with our usual gold standard test. We're going to lift this leg straight up. And Mariam, any low back pain with this? No, just some hamstring tightness there?
Yeah.
Okay. We'll bring this back down, and then we're going to bring this right up. Any low back discomfort with that?
No.
No? Good. Okay. Now we'll do the SI test. So I'm going to bend this knee, bring the hip over, and discomfort there. Perfect. And any discomfort here? A little bit?
Fine.
That's
no,
okay.
Like,
Hey,
no,
be
not
honest, be
really.
honest. This is a treatment session for you, not really?
yeah.
Okay.
Like a little bit.
A little bit on there, okay. So it looks like we're getting a little bit of left SI complaints going on too, but that's totally fine. That's why it's important to get consistent input or consistent therapy or consistent anything really. You don't go for one run and then have a healthy heart for the rest of your life. If you want benefits from massage or benefits from chiro or benefits from physio, you need to be consistent with it. And that's why we pretty much established a good pace, I feel, for you, because you're not getting extreme pain. But Mariam, my hands are coming in on your back now, okay?
Mm-hmm.
All right. So, Mariam's actually, you're even a little bit tender right there, aren't you?
Yeah.
Okay. So Mariam's curve is very mild towards her right side. Okay, the convexity is in the thoracic spine, so kind of like in this direction. Now, anytime we're dealing with a patient who has scoliosis, what's going to happen is that the muscles that are on the concave side, okay, that's the side, that would be her left side in this case, they're going to end up becoming quite tight. And that makes a lot of sense because the space between their connections is lessened by the curve, okay? On the other hand, the muscles that are on the convex side are overstretched, are going to develop some weakness given enough time. So that's why it's important that we work to loosen everything up on the left side, of the concave side, and we work to strengthen the things on the right side through things like regular exercise, whether that's proper resistance training in the gym, or if we're just looking at postural and body awareness exercises using visual feedback such as a mirror to bring that right shoulder back down lower. So for today, we're going to be doing the manual therapy component, which really does involve loosening up everything on the left. And historically, that's what we've been doing, is really targeting these tight structures. So let's feel through. And I think we already found that Mariam's got some tenderness kind of right there, which also happens to be the most concave location, and therefore also probably the tightest part of her upper back right now. Let's go lower down. We got some there too. That's okay. We'll try to take care of all of that today. Now things do even out a little bit as we get down into her lumbar spine. There is a teeny bit of an S shape going on down here too, but it's not as noticeable as the upper back. So SI joints, this is your sacrum, the bottom of your spine. Your iliums are your hip bones proper. SI joints are right in between, feeling through those. I think it was your right side that felt a little bit tender, yes?
Yeah.
Okay, so how's that?
It's good.
That's okay. And how's that?
That's good.
It's okay? Good. So glutes, some tension on the left side, but you're not jumping, so I think you're doing okay. All right, Mariam, I'm going to get you to take a big breath in for me. Actually, you know what? I totally lied to you. I'm going to move the microphone closer.
Yeah.
Because
Okay.
that is the thing that people come to chiro channels for. You okay?
Yeah.
All right, so we're going to go for that adjustment now on the left side. I'm going to get you to take a big breath in and all the way out. There we go. So yeah, lots of tension there, and we did have to give the old 1-2 approach because there was some guarding, but we got through there, and she'll feel pretty good hopefully when she stands up afterwards. Okay. Come up a little little bit higher. And I'm just going to turn your head, okay? Big breath in. And all the way out, all the way out. There we go. There's another one there. Good. Scoot you into the correct position here. Get you to bring your hips towards me, please. Thank you. Bottom leg straight. We're going to pull this. Awesome. And on elbow. Good. Okay. So, check with the camera. Yep, that works. Going to get you to take a big breath in for me. And all the way out. Good, good, good. Got a bunch of them just rolling you over.
Yeah.
There were some more still hiding. All right, we're going to do the other side. It'll get you facing the other way. Right, again, we're going to pull this. Pull. Awesome. That's going to go right here. And this leg's going to come up. And we're going to scooch the hips towards me, please. Perfect. And I will get you to take a big breath in. And all the way out. Good. That was a big one. Good job relaxing. Mariam, when was the last time you had a headache? Was it a while ago or recent?
Probably about a week ago. I was getting very frequent headaches.
Okay, all right. And you didn't call me. I'm only a little bit offended. That's fine.
Well, I knew I was coming in soon, so.
So the reason I'm asking Mariam that is because first thing I'm noticing with her neck, as you guys are probably familiar right now, her suboccipital muscle groups, which are the ones at the very, very top of her spine connecting onto her occiput, which is the base of her skull, are quite tight. And those are the muscles that are frequently associated with cervicogenic type headaches. I do find that patients who get frequent headaches have high hypertonicity in this region. If we're able to bring down the tension in these muscles, usually we see some pretty dramatic changes. So, of course, she's a little bit predisposed to having increased tension within her muscles, so let's help her out today, shall we? Would you like to be helped out today?
Mm-hmm.
Good. Okay. Anyone new to the channel, this is the classic MRT or a myofascial release technique that I do with every single patient that comes through the door. It is a pin and a stretch of the underlying pinned muscles. So. Ooh. Okay, I'm going to get you to turn your head as far as you can to the left for me, please. Good. And good, you're relaxing that head very well. You can tell Mariam's irregular because she doesn't immediately fire on that SCM muscle group that a lot of other patients typically do if you've seen the other videos. So, well done. Very good. Okay, I'm going to move the microphone to the other side. Turn your head as far as you can to the right, please. Good, and you just keep that relaxed. Very good. How did those feel, Mariam?
Good.
Good. So I did find when I initially started treating you, Mariam, your neck, at least I remember it being a little bit more difficult to get. But now it's quite simple at this point. So that's because you've gotten better at relaxing and trusting me. So thank you for that.
Of course.
All right. Mariam, first things first, I'm going to get you to look up and to the right, please. Thank you. And we're going to do a little elbow there. And you're going to look slowly down into your left, okay? Now, Mariam, every patient who I treat on camera, I always ask them a question to try to get a little bit of their character out of them so that people can see. And you know what the question is. It is, what do you find most rewarding about your job, or your favorite aspect of your job? Now, you are a student, so I guess the question should actually be, what do you find most rewarding about being a student and still in your education?
Well, I'm a hard worker, so I like putting a lot of effort, and like especially if I'm like passionate about what I'm doing, I just like seeing that pay off fuels me. So
is there like a particular example you have in mind? I know you were recently accepted, which is good news. Get you to bring your ear down to your shoulder for me, okay? Perfect, just like that.
Yeah, I got accepted. I'm doing like commerce. Oh, right.
Yeah, but you're doing what now?
I'm going to business commerce.
And that is what you want to do, because I know that you want to be an entrepreneur, yes?
Yeah.
Any ideas on that $1 million business yet?
Not yet.
Okay, as soon as you do, let me know. I want to be an investor.
Yeah.
Okay, that's what we'll do.
Yes.
If you guys want to help me be an investor, don't forget to like, follow, and subscribe. The ad revenue helps. Thanks, guys. There's the plug.
That's tight.
That is quite tight, yes. Good. Okay. Now I'll get you to look up and to the left, please. Good. And down to the right. Very good. Up to left. Down and to right. You okay?
Mm-hmm.
You're tough, you're strong. So face forward and tilt your left ear to your left shoulder, please. Cool. There. Better than 50% of my patients right there. Here you go. And right to right. Good. Left to left. Right to right. Left to left. Right to right. Left to left. Right to right. Good. So once again, remember that her left side is going to be the tight side. Therefore, it's more important that we get some force through that side to try to relax everything. Yes, we can still go on the right side. It's not going to be the end of the world. It's going to feel quite good still, but that is not the focus. The left side is what we're trying to release as much as possible. Tenderness down here, Once again, channel, that's the TL junction, the thoracolumbar junction. Absorbs a lot of shearing forces as the thoracic spine and the lumbar spine do two opposite direction movements. That is even more true in individuals with scoliosis. So, unsurprising to feel the tension through here. And we'll do a little bit on the right side as well. Oh, you ticklish. I heard a laugh. That's what that is. Good. Mariam, how did you find all of that to be?
I found it really good, very helpful, because after every session, I'm definitely a lot more, like, relieved, no more, like, pain, yeah.
Good. So, there's a two-pronged approach anytime you're dealing with scoliosis or postural-related issues such as upper cross syndrome, and one of them is definitely going to be that manual care, right, which is the stuff where you're in here, my hands are on it, whether we're doing a sports massage or we're doing just the massage gun or the adjustments, and that's going to be very beneficial in the moment. But one thing that I've kind of prescribed Mariam to be doing, she used to be a very avid gym goer. She used to be very frequently visiting the gym, and she kind of tapered off that lead leading up to her initial presentation. So we've encouraged her to get back to doing that, and I think the last time you were in the gym was 3 days ago, you were saying, right? So we've managed to get her back into a higher level of physical activity. That's very important because the first line of intervention for any scoliosis or postural related complaint is physical exercise. Okay, so don't just only, if you are dealing with a postural issue, don't only rely on seeing a chiro or seeing a physio or massage therapist or whoever your friends, cousins, whatever recommends you to go to. Exercise is the answer because that is something that you can do yourself on your own time to ensure that you're promoting your own health. So in the case of scoliosis, we're looking at heavy row-like movements or things when you are pulling backward. I'll link a couple examples in the description down below, as well as postural awareness. So when I do say that, I mean spending some time in front of the mirror and consciously bringing your shoulders down to the same level is a very good tactic to do. If you do that for long enough, you'll be able to get some neural adaptation and make that your new normal. And that's going to help to even everything out and decrease the associated aches and pains that you can get with this. So there's a big homework component to postural related complaints. Don't only rely on somebody else to do all the work for you. That is the end of my very long tangent, I think. So I think we're good for today. Do you have any other closing thoughts before we head out? Or
No.
No? All right. Well, thanks again for coming in. We can end on a high five. Boom. Very good.
Thank you. Don't forget to like and subscribe.
Thank you, Mariam.